Well, now let's get into the conversation of the night. Work-related musculoskeletal disorders are the most prevalent cause of disability in both developing and developed countries. They are a global public health concern to healthcare systems, social care systems, and they concern individuals because the overall result is reduced productivity, economic drain, work absence, physical disability, and mental disorders. But what exactly are they and how are they corrected? Joining me in studio now is Otieno Martin Ongwen, an orthopedic physiotherapist, and Vincent Gesora Choki, who's a senior physiotherapist at the Kenya Institute of Special Education, who are going to help us shed light on this topic. Thank you so much for making time to come through and shed more light on this topic. Would you mind introducing yourselves to our viewers and tell them who you are?
Thank you, Daphne. I'm Vincent Gesora, a physical therapist from the Kenya Institute of Special Education. Yeah.
And to you?
Thank you, Daphne, for having us as well. I'm Otieno Martin Ongwen. I'm an orthopedic manual therapist. I specialize in musculoskeletal rehabilitation, oncology rehab, and pain science.
I'm very pleased that I have the right people for this conversation. Now, perhaps if we just get right into it, what is meant by musculoskeletal physiotherapy?
Oh, all right. Well, physiotherapy is a medical as well as healthcare profession that focus mostly on movement, habilitation, and how human beings move. We focus on ensuring that we work in different spheres on prevention, management, treatment, as well as ensuring that other people or people with diseases do not transition to disability. Right? So we are involved in triaging, which is assessment of diseases, management and treatment of these diseases, as well as prevention of these diseases.
Thank you so much for that response. Now, if you could tell us, Vincent, what are some of these conditions that require this kind of therapy?
Basically, when you talk about musculoskeletal, in real life sense, or basically, we are talking about the structures, the skeletal and muscular structures, that is the tendons, ligaments, bones, nerves, structures that help us, bear weight, move. So when you talk about musculoskeletal, we are basically saying that these are structures that help us to move. And as you have said, when they are affected, they lead to reduction of productivity in the country's economy. And one of the leading condition under musculoskeletal is low back pain. And it's estimated that under the WHO standard estimates 1.7 billion people around the world suffer from musculoskeletal condition. Low back pain being number one that list. Yeah.
So, Martin, if you elaborate on other conditions, because I bet that is not the only musculoskeletal condition that we have.
Yeah, sure. When we come to musculoskeletal conditions, there are a variety. There are mostly conditions that affect the joints. There are conditions that affect the muscle structure. Tendons. So tendons are where muscles kind of get into bones or attached to bones. We have some of the leading musculoskeletal problems are osteoarthritis, which is as you age, your bone density tends to lower. We have rheumatoid arthritis as well, which is a condition that affects the small joints within your body, but it's an autoimmune disease in the essence that your immune system starts to eat up the small joints in your system. We have other musculoskeletal conditions like tendinitis, which is inflammation within the tendon areas. Of course, Vincent has mentioned low back pain, which is the leading reason as to why people seek care in the musculoskeletal realm. But we also have neck pain, knee pain, hip pain, foot and ankle pain that sometimes you get out of an injury, trauma, for example, or you get it over time because of overuse. But also a lot of the musculoskeletal conditions are programmed conditions that as human beings age, we tend to develop those diseases, and most of them fall within the lifestyle spectrum. So behaviors as human beings.
Vincent, could you elaborate on those behaviors that could perhaps be the causes of these conditions?
As he stated earlier, we have osteoarthritis, which mainly is age-related, but when also we look at low back pain, tendinitis, maybe sprains, some of them are caused maybe due to like long-standing. If we have a nurse who's working and his duty entails him to stand for a long period, we have what we call stress fractures. We could have back pain that leads to that. We also have improper shoes that when one stands for long while using them leads to ankle pain, which later leads to the knee pain, again leading to low back pain. So we tend to advise people to ensure that they use proper body mechanics in terms of when you stand, get proper shoes. When picking up heavy objects, use the right proper body mechanics. And when we're talking about that, we also remember prevention. So we don't wait for the disease to attack you. So let's ensure that we do our exercise and ensure that our muscles and structures are strong enough to prevent occurrences that can be prevented.
You've mentioned exercise, and I'm curious, and also lifting heavy objects. Can we say that heavyweight lifters are susceptible to these musculoskeletal disorders?
I want to say yes and no. It all depends on how heavy they lift, the mechanics that they use in terms of lifting these objects. But ideally, the human body is designed to be robust and strong. So the more you exercise, the more you feed that energy into your body, the more it's able to manage such capacities. All right. So sometimes you find ideally heavy people, you can lift up to twice your body weight. So that is the ideal essence of how much you can lift. So it is not necessarily that heavyweight builders are susceptible to problems. That is because, let me give an example. So your body function has this capacity. So we have an elastic limit of what the body can do. But every day that elastic limit kind of deteriorates. Osteoporosis, sarcopenia, which are kind of like deterioration or programmed diseases as human beings. So if you build your strength and capacity, you tend to increase that. So I'll give an example of when a car has got fuel. It is able to take you from point A, let's say you're coming from Nakuru to Nairobi. If you're less on fuel, you will not reach your destination. But if you have a bigger capacity of the fuel tank, which is strength, flexibility, cardiorespiratory fitness, then you're able to achieve this without necessarily getting problems, the musculoskeletal problems that you're talking about.
All right. That is heavy to take. Now, Vincent, could you highlight some of the signs and symptoms? Because someone may be feeling pain and say, oh, maybe I lifted something and that's where the pain is coming from. Elaborate on some of the signs and symptoms someone is supposed to expect.
Okay, when you talk about musculoskeletal, it's a range of different conditions, and most of them present differently. But generally, we have the general symptoms as pain, swelling, reddening of the part that you've been injured. We have maybe loss of power, loss of strength, and under the nerve we have loss of sensation at the part that has been injured. So basically those are the things that we look at generally. But when you go to specific conditions, we have specific signs and symptoms to help us give a correct diagnosis to the problem. But generally, those are the things that we check.
All right. Now, Martin, if I could come to you for a minute, You mentioned osteoporosis and how different conditions under musculoskeletal conditions require different types of therapy. Could you elaborate on that part, that osteoporosis? Tell us what it is and which kind of physiotherapy is required for that kind of condition.
All right, so osteoporosis is bone degeneration, all right? So that is the diagnosis of it. And as we age, the bone has got different cells. We have the osteoclasts, which are the ones that eat up the bone so that it can regenerate. And we have osteoblasts. So osteoblasts are the cells that kind of restructure and build up the bone density. So when it comes to osteoporosis over years, with lifestyle changes or lifestyle diseases, sometimes it can come earlier than usual. Athletes who do excessive training, go overboard in terms of what their capacity is, develop osteoporosis at an early age. It is more prevalent in women because of different menopausal and hormonal changes that come. And usually when people get over the age of 50, you start having a deterioration in your bone density. So osteoporosis in itself is a disease that affects the bone, and it reduces the bone density in human beings. And that can lead to fractures. So sometimes you find people getting fractures just because of walking from point A to point B, or maybe from a small fall. And how it comes about is old age is one of the reasons as to why it occurs, but also lifestyle behaviors like alcohol consumption, smoking, a lack of movement. So as technology evolves every day, there's people designing how to eradicate movement into human life. But with the eradication of movement, we tend to move less. We tend to sit more. We tend to be a lot more static in one position. So all of these factors lead up to us getting osteoporosis, right? Which can be prevented by healthy lifestyles, exercise, movement, and good nutrition. Reducing alcohol levels of the levels of alcohol consumption that we partake on a day-to-day basis. So that is osteoporosis, and its signs and symptoms are usually they're not seen, all right? They're not felt. It's a gradual progress until it becomes to the extent where the bone has, or the disease has started eating up onto the cartilages that hold the different joints. So that is when it becomes a lot more painful, and it can be diagnosed by use of X-rays and using a bone density test. So, and there was a question on osteopenia, which is ideally a reduction of the bone density. So your bones, somebody with osteopenia has got less bone density compared to the normal people who have just a normal bone density. All right, so that is also a programmed disease which gradually comes on, which you rarely see, right? It doesn't present as a painful experience, but you tend to catch it when people start getting fractures and different pains in their different joints.
So you're saying that many people actually get it when it's too late. Vincent, Martin mentioned a lot of hormonal changes that cause osteoporosis. Could that be contributed by the female contraceptives women take?
Yes, it is contributing to the loss of bone density, but now that is, we can term it as misuse. Our generation, the way they use the contraceptive is not the way it's supposed to be. So maybe in a span of maybe an year, maybe you are advised to use maybe 10 times or less. But our culture, people use it on a weekly basis, like on a Monday, Fridays. Those are days that they use them. So I think the pattern is what makes us more susceptible to or increase the chances of us getting this condition early in life. So if we use them correctly, we can say it won't lead to that. But if used wrongly, then it can be one of the risk factors that leads us to the condition.
Okay, someone may be wondering, why do I need physiotherapy and I can just go to the gym and exercise? What's the difference between physiotherapy and exercise or workout?
Physiotherapists, as I mentioned earlier, are medical professionals within the healthcare space. And they're trained just as doctors are trained, only that we do not prescribe drugs as part of treatment. We prescribe movement, we prescribe exercise. And exercise in itself, we use it as medicine. So for each and every medicine you get from a pharmacy, it has a dose, right? So it is different, but it is different in the essence that we pick a patient, we diagnose the patient, we come up with a treatment plan for this patient, and the treatment plan has got a prescription. The prescription can be exercise, it can be manual therapy, and it's in combination with other disciplines. Because we also assess what drugs, in the process of prescribing an exercise, we are looking at pain and how it presents in our patients. We are looking at does the patient has got other psychosocial factors that we are trained to assess and address. That is the difference between you walking into a gym to go and see a personal trainer. They are not within the medical space field.
All right.
But ideally it should be, I'm not saying this to create a tug of war between personal trainers and physical therapists, but ideally they should work hand in hand in relation to how best do you prescribe structured exercise to the patients that they see. All right. So
even as we come to the end of this particular conversation, Vincent, can you please tell us some practices that could help people prevent these musculoskeletal diseases from occurring?
Basically, as we said, prevention. So you ensuring that you take the right meals, the right do right exercise, and ensure that you're fit. These are the things that will lead to us being less prone to musculoskeletal conditions. And some of them are literally from the young age. So from the young age, as even parents, to ensure that their kids take the right nutrition, don't engage in, drugs, as Martin has said, that is alcohol and consumption of cigarettes and alcohol consumption, and ensuring that you're fit. So keeping fit leads us to not having musculoskeletal conditions. And the others that are age-related and are pre-programmed, as Martin said, and we eventually will get them, to ensure that we just don't get them when we are maybe at 40s. We keep exercising and improving our limits of strength, mobility, yeah.
Well, it has never been said any better. Prevention is better than cure, and all these diseases actually can be prevented. Thank you so much, Vincent.